So just show me the position where you feel that there.
Like right there, a lot. It gets tight right there.
And down. One more time.
Right there, no.
Okay. So this is a shoulder. This is your shoulder blade. This is your upper arm bone.
Okay.
We've got ligaments that hold these two bones together. Everybody's got a different amount of looseness or tightness in those ligaments. It's really common for people to have a bit of tightness in the back and looseness in the front. And the ball is bigger than the socket that it sits on. So that can bring everything into a bit of a forward position. And some people have looseness all over the place. I don't think you're one of those people. So when we did that test, it looked like you had normal shoulder mobility, but your shoulder does sit a little bit forward. So like a little bit forward like that. Let me just bring you up to speed on the anatomy a bit here. So we've got this, I'm gonna draw you a picture here. So we've got this shoulder blade and the upper arm bone, right? You got these ligaments that hold them together. Then there's the rotator cuff. So there's 4 muscles. One of them sits above that bony spine right here, and then it goes underneath the ceiling of the joint there and attaches to the top of the shoulder. That's the one that I think you hurt, okay? Then there's also the infraspinatus and the teres minor. Those are on the back. And then there's one on the underside called subscapularis. So all those rotator cuff muscles, their job is, you can probably tell by how they're set up on here, that their job is to take the ball and hold it to the socket. Like they're stabilizing muscles. And they also pull a bit downward as well, okay? So when you're raising your arm up, your deltoid, like you're familiar with the gym, so your deltoid pulls on your arm there, and that swings your hand out to the side. But then there's a bit of an upward pull with those, and the top of the ball here can ride up too close to the ceiling of the joint and pinch whatever's in that space. We call that impingement. Okay, so you get impingement of the rotator cuff. Another picture here. So if we look at a top view of the socket, it's deepened a little bit by this fibrocartilage labrum, and then the ball is sitting on the socket like that. Now I drew this, a little bit forward on the socket because that's where you keep yours. So when it's like that, I mean, it should be obvious to you. It should probably be centered on the socket, but when it's over there, the front ligaments are getting pulled on a little bit. The biceps long head runs up here. It can get a little bit of stress put on it. The front of the labrum has nerve supply, so that can get a little sore. In some overhead athletes, the biceps gets pulled on so much that it pulls the labrum away from the bone here. Now, you don't really have any of those problems particularly. Mostly it's just this supraspinatus muscle that attaches right up here that's sore.
Okay.
But all these things are just taking stress because the ball isn't centered on the socket. And it should be obvious to you that it should be centered a little bit better. If the ball is sitting forward in the socket, then impingement of that rotator cuff can happen really easily under this arch here. So this is the acromion process and the coracoid process, and this is the coracoacromial ligament. You don't have to remember any of that, but it does angle down toward the front. So when the ball is forward like that, impingement's happening right away. If you pull that back to center, there's a little bit of space to play with.
I see what you're saying there.
You got that? Yeah. Okay, so the other thing you need to understand is how the shoulder blade's supposed to move. Centering, I'll show you that in a minute. Shoulder blade is supposed to upwardly rotate. So if this is your back here, this is your spine, the shoulder blade is supposed to rotate like this. If your arm went up 180 degrees, we would get 60 of those degrees from the shoulder blade going up and 120 from the arm going up, okay? Yeah. And that happens by a force couple. I'm going to introduce a new word here. Force couple muscles working together between upper traps. You familiar with upper traps? Yeah. Like shrugs? Yeah. Upper traps they elevate like that. And serratus anterior. Have you ever heard of that muscle?
Not that one, no.
It attaches to the medial border of the underside of the shoulder blade, like right under here, and then it wraps around and attaches to the ribs.
Okay.
It's a protractor. You only see it on the most jacked bodybuilders, like under here. Okay, so it pulls forward while this pulls up, and it spins the thing. Okay, this pulls up this way, and that's pulling that way, and you get that upward rotation of the shoulder blade. Okay, and that's necessary to keep getting the sealing of the joint out of the way of the arm coming up.
Okay.
Okay. Now, the reason I've introduced that concept too is because we can screw it up pretty easily. I just told you to pull the ball back to center, right? But we can't be pulling the shoulder blade back to center. That's going to shut off the serratus anterior. I mean, not totally shut it off. Like, there can be some co-contraction between the two, but if you're aggressively pulling your shoulder blades back, you're not going to have good use of your protractors. So we can't have that. Same thing with upper traps. If you want to have upper traps working, you can't be aggressively pulling your shoulder blades down. Okay? We need upper traps and serratus working. And it all comes together just perfectly if you allow the shoulder blade to rise about 4 centimeters. You get a little bit of rise in the shoulder blade. Not the most you can do, kind of a middle amount of rise in the shoulder blade. If you're going up to 90 degrees, maybe 2 centimeters of rise in the shoulder blade. But if you can combine centering the shoulder blade, centering the ball, with letting the shoulder blade rise about 4 centimeters, it all works perfectly. Okay. So now I'm going to show you that, and we'll videotape that too if we can. So we're going to hold your wrist just a little bit in front of your arm, just because it works better this way. Just relax your arm. Okay? So now I told you that the ball needs to be centered. Go ahead and do that. Yeah, something like that. But don't try so hard because we don't want you to pull your shoulder blade back. Just go loose. Okay. So I don't want you to pull your shoulder blade back. I just want the ball to go back like half a centimeter, like almost nothing. Just go loose. Just relax. Okay, so take that back a little bit. Yeah, now let it go forward again. That's kind of forward. Take it back again. That's kind of back. So your hand has business in front of you. So like you're about to shake somebody's hand, you're about to do something. Yeah. So I don't want you pulling your elbow back or anything. We just want your arm in front of you, and you're gonna suck the ball back again. That little bit. Let it go forward. So that's forward. Suck it back. That's back. You haven't really pulled your shoulders back. So this is good. So keep it here. And now, as you raise your arm up, you gotta have a little bit more height in the shoulder blade. Okay. So let's start doing that. Tell me if it hurts. Come back down. Lift the shoulder blade a little more. A little bit more. That's right. How's that feel?
Much better.
Okay. I'm just gonna hold that. I'm just gonna measure it. Do you have any pain?
I don't think so. Maybe like in my neck, but I don't think my shoulder, no.
You feel your trapezius working a little bit? So we're at 150 degrees now.
Yeah.
And just as a reminder, when you first did that, you were painful at 115 degrees, right? With a really low shoulder blade and a really forward humeral head. So you're like, and you can probably find it again if you want to. Show me where it hurts.
Oh, where it hurts?
Yeah, when you do that, right?
Yeah.
Okay, that's a really forward humeral head position, really low shoulder blade. We're not interested in if you can find the craziest position for the shoulder possible. We're interested in whether you can find a pain-free position. So you find center, you lift the shoulder blade, more, shoulder blade, this, take it up, no, go back down, shrug,
Oh, okay, gotcha.
more shrug, just go loose, find center, no,
Oh, sorry.
just the centering part, there you go, and now lift your shoulder blade, how's that feel?
It's like nothing.
Almost. Nothing.
Yeah.
And again, you know, lots of range of motion here. Up here, this is where we start to run out of range without like your lats and your pecs
For sure.
pulling the shoulder into weird positions. Everything attaches on the front of the shoulder, right? So your lats attach right here, in underneath that biceps long head in that groove. Your pecs attach right here. So the biggest muscles on your body attach on the front of the shoulder. So when you raise your arm up, tightness in the lats wants to pull the ball forward.
Yeah.
You know, if you reach back like this, tightness in your pecs wants to pull the ball forward. Everything wants to pull the ball forward. If you're pushing or you're pulling, using those muscles, same deal.
Yeah.
And it's the job of the rotator cuff to keep that ball centered and get that shoulder blade to come up and up through upward rotation. Just go loose. Suck that back just a bit. Lift the shoulder blade. There you go. If you can do that comfortably, now the next step is we have to be able to reach comfortably. We have to be able to do things that you actually need to do. This one movement pattern, you can master that right here, and it's not going to change how you reach, and it's not going to change how you throw that fiberglass stick to strap pipe, right?
Yeah.
So the next thing we want to do is practice the reaching. And when you do that, you know, you got to try to make it a little bit more natural. You can't just do this like straight up. Nobody reaches like that. So you can bend your elbow, you can do whatever you want. But what you have to do is center the ball and lift your shoulder blade a little bit. Let your elbow bend. Go ahead. Okay, how'd that feel?
It's good.
It's okay?
Yeah.
Okay, so I liked it until I didn't.
Okay.
So you did lift your shoulder blade,
Yeah.
and you were centered, but then you weren't at the pen yet. And what did you do to get to the pen?
Kinda
You just
lean.
sort of like
Yeah.
adjusted your
Then you
shoulder
go
and lost center. You can walk closer, you can turn your body like this, like you can do a
Okay.
few things,
Okay.
but you can't lose center.
Okay.
So put the pen down.
Got you.
Okay, so this time, if you find center, and then you lift your shoulder blade up, and you're not at the pen yet, maybe turn your body, maybe walk closer, but you can't lose center.
Okay.
You can take a step if you want. Okay, now that's still a little bit robotic, but
Yeah.
that's the gist of it.
Yeah,
So
got you.
Center, that's
Yeah.
too much. Less center, just right there. Lift your shoulder blade, that's too much. Right about there. And if you're not there yet, maybe turn your body, you know, maybe take a step. Okay, go ahead, but don't compromise this thing that keeps you pain-free.
Got you.
Your supraspinatus has just no tolerance for abuse right now. So you've got to find, first the hand moves forward, then you find your center, then you lift your shoulder blade, that's too much. Right about there. And then, you know, keep that while you do whatever you need to do to get your hand there.
Got
Does
you.
that make sense?
Yeah.
Can you put it up there pain-free? Don't try so hard. It's less. Less is more. That's too much. Just sort of a middle ground. Don't pull back super hard. That's
Okay.
centered. And then let your shoulder blade go up. That's too much. Hold it right there. How's that feel?
It's a lot better.
Just walk back. Go back in. See if you can go full speed without making it weird. That looked pretty good.
Yeah. It's lots better than nothing for sure. Like way better.
Come back faster. That's trying too hard a little bit, but it looks pretty good. Looks pretty good, but you're trying a little too hard.
Yeah, I'm very thinking about it. Yeah.
Walk back in. That looks pretty good. How's that feel?
That's good. Yeah.
It's okay?
Yeah.
It's not too weird. I mean, it looks pretty natural considering you've only done it like 10 times.
Yeah. Exactly.
Now we have to just master that movement pattern with a whole bunch of different little exercises.
Yeah.
We always give these band exercises and they're okay.
Yeah.
They can build some strength in positions where there's no impingement. But now if you start practicing centering and moving the shoulder blade like it should,
Okay.
then they really come alive as good exercises.
Okay. Perfect.